Is there an update on the 23 cases?
We'll be giving an update later today, but all the advice I've been getting is that things are going well. This is the fourth cluster in the pandemic for South Australia. We acted swiftly and decisively in the three original clusters and closed them down. We're doing the same in this one.
So can you tell us whether you have any new cases from the testing that was conducted yesterday?
There'll be an update later today.
Okay, so we'll wait for that update around mid-morning. Stephen Marshall has just said that he thinks that you have nipped it in the bud. That is got to be good news. So should we be expecting single-digit figures?
It's really important for us to act swiftly. What we found in the context of this cluster, that a group of cases were linked to a pizza bar in the northwestern suburbs of Adelaide. That infectious period was 10 days, which threatened hundreds, if not thousands, of additional contacts. So this six-day community pause is all about disrupting the chains of transmission, giving our contract tracers the opportunity to identify people who need to be quarantined. So far, we've quarantined more than 5,000 people. This is a major effort to try and close down this cluster.
Given that, and we're hearing from Stephen Marshall that you have, quote, nipped it in the bud, perhaps this six-day quarantine is overkill. You're not even letting people out for exercise. Why?
I think it's really important to be clear that this six-day community pause is designed to nip it in the bud. We'll know as the days go forward as to how successful it's been. At the end of the six-day period, the public health team will make an assessment of progress made, and then we hope to have limited easing of restrictions for 8 days before returning to if you like, what we were hoping to deliver before. Let's be clear: the South Australian government, right through this pandemic, has had some of the lightest economic and social restrictions of any state. We believe that we've been able to do that by having a decisive response to clusters. We've done that in 3 clusters and successfully closed them down. We're using exactly the same approach in this one.
Mr. Wade, if the news is as good as it sounds in terms of this cluster being contained, will there be a review after 6 days? Is it possible that South Australians can go back to life as normal after this 6-day harsh lockdown, or will you still continue with that 8 days second tier?
We've made a clear commitment to constantly review the restrictions, but at the end of the 6-day community pause will be an opportunity to reset towards the balance of the 14. I hope that even in the balance of the 14 we can get as close as possible to the restrictions that we had before the cluster outbreak. Our government is very committed to opening up the society and the economy. It means that we, if you like, are more vulnerable to an outbreak when it occurs. That means why we need to be doubly vigilant in acting swiftly and decisively when an outbreak occurs. That's what we've done with the last 3 clusters and successfully closed them down. We're determined to do the same with this one.
Well, this is all stemmed from flaws in hotel quarantine. How did that security guard get infected? Do you know?
We're still under investigation. In fact, the most likely source is actually the cleaner, a person who wouldn't even have direct contact with residents. And I think that highlights how highly infectious this disease is. It can be transmitted through surface transmission. In this cluster, there are other cases where we suspect surface transmission was involved, and even in the direct relationship with residents, we need to appreciate this is a highly infectious disease. Highly trained nurses with full PPE in acute hospital settings still catch the virus. We need to accept the fact that infections will occur. We need to make sure that when they do occur, we make sure that a case doesn't become an outbreak. That's what we're determined to do in this case.
The lessons, I mean, we all learned the lessons, we'd hope, from the private security being used at the Melbourne hotel quarantine facilities, in the medi-hotels there. You're still using private security in South Australia. Why?
We were subject to a national review like all the other states and territories, and our hotel quarantine was given a gold star. The fact of the matter is, from day one, police have supervised hotel quarantine in South Australia, backed by nurses, backed by security guards. We believe that our hotel quarantine system is robust, but of course we're always looking for opportunities to improve. We'll certainly be doing that in this case.
Well, Minister, it can't be that robust because now you're in the harshest lockdown Australia has seen during this pandemic. This security guard had 2 jobs, one at the Medi-Hotel and one at a pizza place. Are you going to allow that to continue?
Those are the sorts of issues that we'll need to look at. But let me challenge you on this claim that it's the harshest lockdown. This lockdown is a community pause for 6 days. Victoria experienced a lockdown for more than 100 days. We are determined to nip this cluster in the bud so that we can avoid a second wave. We haven't got significant community transmission. All of our cases are linked, but this is a strong epidemiological response, a clear public health response to protect lives and jobs in South Australia.
Victoria did let people out for exercise at least for 2 hours a day, though. You're not even allowing that. Let me ask you about contact tracing. Are you prepared? Do you have the personnel to undertake the task ahead of you?
Our contact tracing teams are working very hard and working very effectively, but we're also greatly appreciative of the support that's coming from other jurisdictions. Western Australia and New South Wales have already been engaged. I understand the Commonwealth and the ADF. We've also had offers from Victoria, so we greatly support the bolstering of our capacity. But we have strong contact tracing teams who are doing a good job. This 6-day pause gives us both an opportunity to disrupt the transmission lines of infection. It gives us the opportunity to identify close cases and to isolate them, and it also is a welcome opportunity to disrupt the spread of the disease through the community.
Minister, what's the science behind not even allowing outdoor exercise for an hour a day?
Well, we saw that in the Victorian context that was a significant risk in terms of fostering community transmission. This is also not a shutdown for more than 100 days. This is a community pause for 6 days. We believe that that's manageable.